Hello everyone, this video we are going to see about Down syndrome.
I am Dr. Celeste Mary, Vice Principal in Administration at Triplam College of Nursing.
Objectives: by the end of the session, learners will be able to define the term Down syndrome, enlist the etiology and types of the condition, explain the risk factors, and describe the clinical features of and complication of Down syndrome, and explain the diagnostic evaluation and discuss the medical and nursing management of Down syndrome. Introduction about the topic. The term Down syndrome was first described by John Langdon Down in the year 1866 and it was described as Mongolism. In the year of 1959, the French doctor Jerome Lejeune discovered it was caused by inheritance of an extra chromosome 21. It is an autosomal disorder and it is also called as trisomy 21. Definition: Down syndrome is a genetic disorder caused by abnormal cell division results in an extra copy of chromosome 21. So, individuals with Down syndrome have total 47 chromosomes. Moving on to the etiology, it occurs about 1 per 1000 babies born each year and it is one of the most common chromosomal abnormalities in children and it is caused by an error in cell division called non-disjunction. With non-disjunction, the gamete is produced with an extra copy of chromosome 21. When combined with the normal gamete from other parent, the embryo now has 47 chromosomes with 3 copies of chromosome 21. Next, we can see about types of Down syndrome. First type is trisomy 21 occurs 95%. Here in extra chromosomes. Instead of normal chromosome 46, the individual with Down syndrome has 47 chromosomes. Second type is translocation, that is 3 to 4% this condition occurs. Here extra 21 chromosome is attached or translocated to another chromosome. Usually the chromosome numbers 14, 21 or 22, it occurs translocations. Third one is mosaicism, that is some cells have 47 chromosomes and others have 46 chromosomes. The mosaicism is thought to be a result of error in cell division, that is meiosis, soon after the conception. Here we can see about the risk factors. Advanced maternal age, and the mother more than 35 years above and a mother who already have one child with Down syndrome and parents who are carrier of genetic translocation are the highly risk factors. Next, we can see about clinical features of Down syndrome. That first part about head and neck, the features are brachycephaly, it is dysmorphic features of the head, and mongoloid slanting of eyes, and epicanthal folds, the space between the eyes will be the high more, and brush filled spots, and flat nasal bridge, and folded or dysplastic ears. The child will have the open mouth and protruding tongue, short neck, excessive skin at the nape of neck, and nystagmus, hypertelorism. These are the features we can see it in head and neck areas. And the features seen in extremities are short broad hands and short fifth finger will be short and transverse palmar creeps, that is the single palmar creeps, and space between the first and the second toe will be there, decreased muscle strength of the child and hyperflexibility of joints and hypertonia, vitamin D deficiency will be seen in condition. Here we are going to see about other health related problems seen in Down syndrome. Cardiovascular problems such as ventricular septal defect, atrial septal defect, patent ductus arteriosus, and in endocrine problems, thyroid problem and growth retardation, diabetes mellitus, etc. And about the GI problems, duodenal, esophageal and anal atresia and Asperger's disease. Hematological conditions like acute leukemia, transient myeloproliferative disease, and neurological conditions like epilepsy, severe behavioral problems, Alzheimer memory problems, etc. Skeletal conditions like flat foot, muscle hypotonia, joint laxity, and atlantoaxial dislocation, Visual conditions like refractive disorder, strabismus, tear duct stenosis, nystagmus, and obesity and nutrient deficiency like malabsorption, lack of vitamin B12, folic acid, zinc deficiency. All these are the conditions related to Down syndrome. Moving on to diagnostic evaluation, the prenatal screening, the investigations like ultrasound, blood test, biochemical test, and maternal serum screening, we can rule out the condition, and also the diagnostic test like immunosynthesis, chorionic villus sampling, we can finalize the condition. Moving on to the management, there is no specific management for Down syndrome. Symptomatic treatment for infection, nutrition deficiencies, and associated congenital malformations. Daily supportive care should be provided to prevent acute health hazards. According to IQ level, the child can be trained in self-care. Our parents should provide daily routine care for health maintenance. Next, about the nursing management. Nurse should collect the history of mother pregnancy, the birth history and genetic testing, observe the physical characteristic features of the Down syndrome and assess the following conditions in child like respiratory functioning, heart sounds for presence of murmur, bowel functioning of the child, cognitive development and skin integrity, and determine the family knowledge, coping and support of the child, and observe interaction and bonding between mother and child. Next, about parental counseling has to be given. And about mortality, average lifespan is 25 to 50 years. Most likely cause of death is congenital heart disease, hypothyroidism and leukemia. Improved survival is because of increased placement of infants in rehabilitation homes and changes in treatment, and survival is better for males. Thank you.